Hello, 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 YouTube world. It's Miss Patty with 4YourCNA here for our CNA practice test game show. For those of you that don't know, we do this on the first and third Tuesday of almost every month. Sometimes I get a little backlogged, but for the most part, we do this on the first and third Tuesday of every month at 11 a.m. And this is the highlight of my week. I love coming in here and hanging out with you guys and going over some practice test questions so we get you ready for that state exam, or just to challenge your own knowledge to make sure that you're performing in the best possible way as a CNA. So welcome, welcome. When you guys come in, if you can give me a hello in the chat, let me know that you're here. We'll get started in about 3 to 4 minutes, just waiting for everybody to come in. Hello, Alexis. Hi, Helen. Happy New Year to you too. Hey, Jen. Yeah, I haven't seen you in a while. Hi, Melvis from Dubai. That's so exciting. Oh, my voice is a bit low. I'm so sorry. Let me see what I can do about that. Give me 1 second. Good morning, AJ. Good morning. So give me just a second. Let me see. Let's just see what I can do. Can everybody else hear me okay? I'm trying to figure out how to boost my audio here. Let's just boost that a little bit. How's that? Is that better? Is that better? Good morning, Andina. Hi, Melissa. Hi, Primrose. Hi, Emily. First time. Welcome. Good morning, Brenda. Okay. Thanks, Alexis. I sound clear on your end. Very good. Okay. Hear me fine. Awesome. All right. You guys ready to get started? Let's go over the rules. So today's topic is because I started a new class yesterday. Those of you that joined us, thank you so much for joining. But we had a new class session starting yesterday. And because they're brand new, yesterday was our first day in the classroom, today I thought it would be appropriate to go over some fundamental questions. So today's topic is going to be related to the role of the nurse aide. Now, for some of you, these questions are going to be super simple. And I know that. Remember that today is all about fundamentals, right? We're not getting into a lot of the nitty-gritty today. Just basic knowledge of the scope of practice of the CNA and what their role is in the healthcare setting. So this is actually on the state exam. About 20% of the questions on the state exam is going to come from this topic. So you can see it right over here. This is the test plan. So about 20% is going to come from the role of the CNA, communication, that type of thing. So we're going to jump right into it. Just so that you know, you will have 60 seconds for the question. I'll read it to you along with the answers, and then you'll have about once I'm done reading it, about 45 seconds to make your selection. Now, you're going to type into the chat 1, 2, 3, or 4. These are numbers. Number 1, number 2, number 3, or number 4, and then hit the send button. Now, the program that I use will accept the answers in the order they are received into YouTube. So very, very important. The order that you see it may not be the order that YouTube receives it, because sometimes there's some delays in that transmission. So keep that in mind. But my program will read your answers and it's going to award points. Now, the fastest right answer gets the most points. And we're going to keep track of this on a leaderboard. And at the very end, we'll see who had the most points for the game. And we're going to give you prizes. This is a real game show with real prizes. And the prizes for first place are a t-shirt. So you can have this one. That's, over here, CNA Care Crew. You can also have this one, which I don't have a picture of, but it's a heart. It says call to care. And if you don't like those, we have another one. This is one of my favorites. It's got CNA, Become, Inspire, and care, because that really sums up what we do, right? We become, and then we inspire others to care, not only for our patients, but for those around us. So that's going to be first place. You get a t-shirt. Now, I know my first place last month hasn't gotten your t-shirt yet. Please bear with me. We're a little bit behind. Your t-shirt will be coming, hopefully this week, but we had a lot to do in December, and I just got really far behind. So bear with me. That anyone that wins first place this week, there may be a little bit of a delay in getting your t-shirt out, but we'll get it to you as quickly as possible. Trust me, I try to get this stuff out so it doesn't have a backlog. Now, second place is going to get our CNA Principles card game. So this is what it looks like. It's a lot of fun to play. It's a lot of strategy to it. It's kind of like a rummy game, but with CNA principles. And then there's some specialty cards in there that are designed to trip you up, like a HIPAA violation or a fire drill or a call-off crisis. So it's a lot of fun to play, and second place is going to get that for free. Third place is going to get, where is it? Some motivational items like a keychain and a bracelet. So motivational items. All right. So Jen took a supervisor position. Awesome. Very good. Very good. All right. So are you guys ready to get started? Are you ready to get started? Oh no. Okay. So, oops, sorry. Okay. So give me 1 second, guys. Give me 1 second, because unfortunately I did not set this up correctly this morning. Apparently I didn't have enough coffee. So give me just a second here. I'm going to set up the pictures that we need, that we always use. So give me a second. I'm so sorry. I'm unprepared today. Oh. Okay, hold on. Almost there. Save changes. I gotta do this one too. This program is so neat. Such a neat program to be able to do a live game show with you guys. So I'm really, really, really thankful to the people that made this for me. So cool. All right, hold on 1 second. By the way, those of you who don't know, we have a new classroom that we are in, and I absolutely love it. The classroom belongs to my good friend Julie. She is an inventor. She's a CPR instructor, but she's also an inventor, and she invented something called stack strips, which are used in, there we go, we're going to save that, go back to our control room, and let's see. That should work. So she invented something called stack strips, and she uses her CPR room a couple times a month, so it's sitting empty a lot. So she's letting us come in and teach our CNA class in there. So huge shout out to my good friend Julie for making that possible, and I love our new setup. All right, question number 1. Which task is within the CNA's scope of practice? 1, administering medications. 2, assisting with bathing. 3, changing a wound dressing. Or 4, diagnosing a condition. Go ahead and lock in your final answer. Oh, I'm sorry, guys. You don't, yeah, I'm so sorry. You're not seeing the pictures. Okay, well, we'll just have to go with it today. Sorry. All right, go ahead and lock in your final answers. Lock in your final answers. Told you it was going to be a fundamental one. So yeah, you got 15 seconds left. Everybody seems to be in agreement here. Go ahead and lock in your final answers. And the right answer here, of course, you all got this because you're super smart CNAs. Assisting with bathing is an appropriate task for a CNA, well within their scope of practice. Remember, scope of practice is defined as following the care plan, performing routine tasks on stable patients that you've been trained to do according to the care plan. So remember, that is our scope of practice. If it's not a routine task, if it's not a stable patient, if that means judgment's going to be required. You're going to have to make decisions. If you haven't been trained and if it's not on the care plan, then it is not in your scope of practice. So if you can remember those 4 things, it makes it really easy to figure out whether this is an appropriate task or not. So Rissa came in first on that one, followed by Andina, Ava, and Hamdi. Oh, Andina, you have got a really unique name. Question 2. When should a CNA report to the nurse? 1, when a resident refuses care. 2, when a resident is resting. 3, after finishing their daily tasks. Or 4, after the CNA has changed the care plan. Go ahead and lock in your final answer. So when should a CNA report to the nurse? 1, when a resident refuses care. 2, when a resident is resting. 3, after finishing daily tasks. Or 4, after the CNA has changed the care plan. So go ahead and lock in your final answers. You've got about 5 seconds left. Go ahead and lock in. And our right answer here is number 1, when a resident refuses care. Now, anytime, patients have the right to refuse care. It's a part of their resident rights, actually. Any patient has the right to refuse any task at any time for any reason, and we have to respect that. But when a patient refuses care, we're required to notify the nurse. So maybe the patient needs a little bit more education about why this task is required. Maybe the nurse needs to figure out why the patient is refusing. But we have to report it as a CNA. We don't have to let them know when the patient is resting or when you finished your tasks. And CNAs never change the care plan. That is outside of our scope of practice. Remember, scope of practice. Ava came in first on that one, followed by Rissa, Hamdi, and Alexis. Good job, guys. We're going to go to question number 3. A CNA observes a resident with chest pain. What is the first step? 1, call the resident's family. 2, notify the nurse immediately. 3, offer water to the resident. Or 4, wait to see if it improves. So a CNA observes a resident with chest pain. What is our first step? 1, call the family. 2, notify the nurse. 3, offer water to the resident. Or 4, wait to see if it improves. Go ahead and lock in your final answer. You've got about 20 seconds left. Yeah, I'm sorry about the background, guys. It's showing up on this screen, but it's not showing up on yours. All right, about 10 seconds left. And the right answer here, yes, is an easy one. Yeah, we're going to notify the nurse. Absolutely. Any change in the patient requires us to notify the nurse. But emergencies require us to notify the nurse immediately. Rush, right? Chest pain can possibly be a sign of heartburn, yes, but it could also be a sign of a heart attack, and we need to act quickly, right? We need to intervene very quickly. It's never a CNA's responsibility to call the family. Now, offering water to the resident, that's not going to help if they're having a heart attack. We've got to get them some help, and we definitely don't want to wait to see if it improves, because lasting damage might be happening to that heart muscle. Alexis came in first on that one, followed by Rissa, Ava, and Hamdi. You guys are super smart. All right, we're going to move on to question number 4. Which of the following tasks is outside of a CNA's scope of practice? 1, turning a resident in bed. 2, administering tube feedings. 3, feeding a resident. Or 4, measuring vital signs. So go ahead and lock in your final answer, 1, 2, 3, or 4. Which of the following tasks is outside of a CNA's scope of practice. Now, you're going to see questions like this on the state exam because they want to make sure that you truly understand your scope of practice. Remember, that's a routine task on a stable patient that you've been trained to do according to the care plan. So we have to think about the things that we've been trained to do to answer this question. And about 5 seconds left. The right answer here is, of course, number 2. Yeah, y'all got this right. Administering tube feedings, not within the scope of practice of a CNA. We are not going to be trained to do that. That is not a CNA task. That is a nursing function. Now remember that you can be trained to do other tasks outside of what you learn in your CNA class. Now this is a process called delegation. The nurse identifies a routine task on a stable patient that needs to be done, trains the CNA to do that, but that has to be according to some guidelines. It has to be okay with the state, right? The State Board of Nursing defines what tasks a CNA can do in that state, but it's also going to be got to be approved by the facility as a delegatable task. So Ava came in first on that one, followed by Hamdi, Alexis, and Jen. Good job. Good job. Here we go, question number 5. What should a CNA do if unsure about a task? 1, perform it quickly. 2, ask another CNA to do it. 3, consult the nurse. Or 4, just skip it entirely because you're not sure. So what should a CNA do if unsure about a task? Perform it quickly, ask another CNA to do it, consult the nurse, or skip the task entirely. Go ahead and lock in your final answers. You got about 25 seconds. All right. Yeah, this one could be a little bit tricky. You have to think about the wording here. What should a CNA do if unsure about a task? Go ahead and lock in your final answer. And the right answer here is number 3, consult the nurse. So some of you guys put number 2, and let me explain to you why that's not correct. Have you ever played that game telephone where you tell somebody something and then they tell it to somebody and then they tell it to somebody and it moves around a room? It's never the same story, right? Well, remember that CNAs are there to assist nurses with routine tasks on stable patients according to the care plan. Another CNA is not going to know the care plan for that patient or how the nurse wants that task done. So asking another CNA is not the right answer here. We need to go to the source. We need to consult the nurse. If I'm not sure how to do a task, I need to talk to the person that wants me to do that task to get more information. Jay came in first on that one, followed by Ava, Rissa, and Alexis. Great job, guys. Here we go, question number 6. A CNA observes bruises on a resident. What is the correct action? 1, ignore it. 2, report it to the nurse immediately. 3, ask the resident how they feel. Or 4, apply a cold compress. So our CNA observes bruises on a resident. What is the correct action? 1, ignore it. 2, report it to the nurse immediately. 3, ask the resident how they feel. Or 4, apply a cold compress to get rid of that bruise. What do we want to do here? Go ahead and lock in your final answer. About 10 seconds left. Yep. So the right answer here is number 2. Anything that we notice with the patient, anything, but especially bruises, scrapes, scratches, swelling, things that might potentially indicate that the patient was abused in some way or suffered an injury in some way has to be reported to the nurse. Even if you think a coworker may have done it accidentally, doesn't matter. We have to report everything that we see, hear, smell, or feel to the nurse, but especially if it might indicate an injury. So good job. Good job there. Ava came in first, followed by Hamdi, Alexis, and Jay. Good job. Moving on to question number 7. Which of the following is a primary CNA responsibility? 1, diagnosing illnesses. 2, writing care plans. 3, providing personal care. Or 4, meeting with families to coordinate care. So which of the following is a primary CNA responsibility? Yeah, Blue. Hey, Blue. Good to see you. Yeah, I know, but still it has to be reported. Absolutely. Yep. Sometimes patients don't want it reported, but it still has to be reported. Yeah, and very interesting story that you emailed me. Thank you for sharing that. And we'll talk about that a little bit later, the scope of practice and following the care plan. All right, go ahead and lock in your final answer. And number 3, providing personal care. So diagnosing illness, that's going to be a doctor's responsibility, not ours. Writing care plans, that is a nurse's responsibility, not ours. And meeting with families to coordinate care, that's usually part of the care team. Discharge planner, social services, dietary, nursing, therapy. So that's going to be the care plan team. As a CNA, our responsibility here is to provide personal care, basically to help patients that can't do things that they normally do themselves, right? Okay. Ava came in first, followed by Rissa, Melissa, and Alexis. All right, moving on. Question number 8. When should a CNA refuse to perform a task? 1, if it's not in their scope of practice. 2, if it requires communication. 3, if it involves teamwork. Or 4, if they feel tired. When should a CNA refuse to perform a task? 1, if it's not in their scope of practice. 2, if it requires communication. 3, if it involves teamwork. Or 4, if they feel tired. I'm tired. All right, go ahead and lock in your final answer. You've got about 10 seconds left. What do you think is the right answer here? And yes, CNAs can refuse to perform tasks in certain situations. All right, the right answer here is number 1, if it's not in their scope of practice. Not only can you, you should refuse to do a skill if it's not in your scope of practice. So let's review scope of practice one more time. Remember, scope of practice is designed as a routine task on a stable patient, so no judgment, no decision making, that the CNA has been trained to do, and it's according to the care plan. So those are the 4 things that we need to make sure that we know is our scope of practice to keep us firmly where we belong. And anything that we're asked to do outside of those 4 things, we have to tell the nurse we cannot do that task. So routine task, stable patient, you've been trained, and it's on the care plan. All right, Alexis came in first, followed by Ava, Jay, and Rissa. Good job. Number 9, a CNA notices a resident's catheter is leaking. What should they do? 1, irrigate it with normal saline. 2, notify the nurse immediately. 3, remove the catheter. Or 4, continue care because this is normal. So a CNA notices a resident's catheter is leaking. What should they do? 1, irrigate it with normal saline. 2, notify the nurse immediately. 3, remove the catheter. Or 4, continue care because this is normal. Go ahead and lock in your final answer. You've got about 15 seconds left. Those of you just joining, I'm so sorry about the graphics behind the screen here. I messed up. Sorry. You get an orange screen today. All right, the right answer here is to notify the nurse immediately. Absolutely. You guys all got this one, no problem. Now, the nurse may irrigate it with normal saline, or the nurse may decide to remove the catheter. Right? Both of those might be appropriate actions for the nurse to take after further assessment. But that's not a CNA task. We don't make decisions like that. We don't assess patients. So our job, when we notice anything, is to report it to the nurse so they can make the assessment and decisions. You don't want to continue care because a leaky catheter is not usually normal unless the nurse has told you, yeah, the catheter's leaking, just go ahead and do care, I'm aware of it. Now, then you can just continue care because you've received that information from the nurse. Ava came in first on that one, followed by Jay, Rissa, and Hamdi. Good job, guys. Moving on. Who is responsible for delegating tasks to the CNA? 1, another CNA. 2, a licensed nurse. 3, the resident's family. Or 4, the physician, the doctor. Who is responsible for delegating tasks to the CNA? 1, another CNA. 2, a licensed nurse. 3, the resident's family. Or 4, the physician, the doctor. I'm sorry, Melvie. I'm so sorry that you can't see and that you have to wait for me to read the question. I'm so sorry. All right, go ahead and finalize your answers. You got about 10 seconds left. This one was a little bit harder, wasn't it? A little bit harder. So the right answer here is a licensed nurse. This is called our chain of command. Nurses assess patients. This is the nursing process. Nurses assess patients, write out care plans. Care plans give us tasks to do. While we're doing those tasks, we make observations, report them back to the nurse. The nurse reassesses the patient and modifies care plan. This is the whole care planning process. CNAs do not they're not able to delegate tasks to other CNAs, and you cannot take a task delegated by another CNA. Now, in some cases, if you're doing private home care, you might have picked 3, but this is not part of the nursing chain of command, and doctors have nothing to do with CNAs, nothing. So good job. Good job. Alexis came in first on that one, followed by Rissa, Hamdi, and Jay. If you think these questions are helping you, give me a thumbs up. That way YouTube knows that you like this. Which task requires immediate reporting to the nurse? 1, a resident asked for a blanket. 2, a diabetic patient ate his entire meal. 3, resident requests privacy when the family visits. Or 4, the resident falls out of bed. Which task requires immediate reporting to the nurse? 1, a resident asked for a blanket. 2, a diabetic patient ate his entire meal. 3, a resident requests privacy when the family visits. Or 4, a resident falls out of bed. So go ahead and lock in your final answer. You've got about 10 seconds left. Awesome, Heidi. I'm so glad to hear that. Usually about 11:45 is when we end, Alexis. The right answer here, yeah, you guys all got this one. When the resident falls out of bed, yeah, that has to be reported immediately, right? They fell. This is a potential injury. That has to be reported right away. But let's go through these other ones because there's a little bit of truth in each one of these. If the resident is asking for a blanket and they're cold and nobody else is cold, they may be running a fever. That might need to be reported to the nurse. A diabetic patient that ate all of his food, that's a good thing because we want those blood sugar values to normalize. But if they're still hungry, we've got to report it to the nurse. And sometimes if we think the family might be a little manipulative, if a resident asks for privacy when the family visits, that could need to be reported as well. So Jay came in first, followed by Ava, Cass, and Hamdi. However, falling out of bed, that's an immediate report. All right. A nursing home resident complains of shortness of breath. What should you do? 1, call 911. 2, notify the nurse immediately. 3, give the resident oxygen. Or 4, check their vital signs yourself. A nursing home resident complains of shortness of breath. What should you do? 1, call 911. 2, notify the nurse immediately. 3, give them some oxygen. Or 4, check their vital signs yourself. So go ahead and lock in your final answer. You've got about 15 seconds. About 10 seconds. You guys are so smart. I got to write harder questions. All right, the right answer here, yeah, notify the nurse immediately. I know it's kind of a no-brainer, right? You got a patient with shortness of breath. The nurse needs to know about it. She's got to assess it. Yeah, maybe they need oxygen, possibly. Maybe we want some vital signs to figure out what's going on. Yeah, that could be. And maybe the nurse wants to potentially transfer them out because they're in a nursing home. Maybe they need to be in the hospital for further evaluation. All of those are possibilities, but that's not really the scope of the CNA. Our job is to notice a problem and report it off to the nurse so that they can make the next decision. Remember that CNAs don't make decisions. Okay, we perform care or we notify the nurse. Hamdi came in first, followed by Ava, Melissa, and Rissa. Is this helping you guys understand your scope of practice a little bit better? I hope it is. Who is responsible for evaluating a resident's care plan? 1, the CNA. 2, the resident's family. 3, social services. Or 4, the licensed nurse. Who is responsible for evaluating a resident's care plan? 1, the CNA. 2, the resident's family. 3, social services. Or 4, the licensed nurse. Go ahead and lock in your final answers. You've got about 20 seconds left. This one's a little bit harder. You got to pay attention to the wording of the question. Be really careful about this. Pay attention to the wording of the question. There's one word here we're going to pay attention to. Oh, excuse me. Yes, Alexis, you are correct. Evaluating is the key word here. The licensed nurse is going to evaluate the care plan. They're going to develop it and they're going to evaluate it for changes. So evaluating is the key word in this question. Now, if it said who is responsible for carrying out the care plan, well, that would be the CNA. Or who is responsible for providing information to develop the care plan? Well, the resident's family and social services might be appropriate there. But as far as evaluating, that's always the licensed nurse. So good job, guys. Thank you, Jen. Ava came in first, followed by Melissa, Rissa, Hamdi, and Andina. What should a CNA do if a resident refuses care? 1, insist that the care needs to be performed. 2, ask another CNA to try. 3, notify the nurse. Or 4, tell the family that the patient is being non-compliant. So what should the CNA do if the patient refuses care? 1, insist that the care needs to be performed. 2, ask another CNA to try. 3, notify the nurse. Or 4, tell the family that the patient is being non-compliant. You've got about 15 questions left. I think this is number 14, Ava, but I've kind of lost track. So I think this is number 14. I think we have one more to go. All right, go ahead and lock in your final answers. And the right one is, of course, number 3. Yes, if the patient refuses care, we're going to notify the nurse. We talked about this about 20 minutes ago, right? So patients have the right to refuse care, but it's our responsibility to notify the nurse when that happens. We don't want to insist. That's not really our role. We can make sure that they, feel comfortable with us, but we don't want to insist. And we don't get to delegate to other CNAs. Telling a family a patient's non-compliant, that doesn't really do any good. And that's a label that CNAs really should not be using. I don't even think nurses should be using that as much as they do. All right, Ava came in first, followed by Alexis, Rissa, and Cass. Yep, provide education, document, and move on. All right, last question. Which task should a CNA prioritize first? 1, organizing supplies. 2, toileting a resident on a toileting schedule. 3, assisting a patient to an activity. Or 4, answering a call light. Now, this is the hardest question we have in this session. I saved it for last. Which task should a CNA prioritize first? Yes, it's tricky, Alexis. 1, organizing supplies. 2, toileting a resident on a toileting schedule. 3, assisting a patient to an activity. Or 4, answering a call light. Tricky, tricky, tricky. 5 seconds left. Go ahead and lock in your final answer, and then we'll talk about this one. And the right answer here is answering a call light. Yes. So let me explain what I'm gonna pause this for just a second so that we can talk about this. Okay. So here's the thing. When you go into work and you get your shift report and you find out your patients and you get all the information that you need to care for them, you're probably going to be going to the supply shelf and figuring out what supplies you need and restocking and just kind of getting ready for the shift that's coming up. So organizing supplies is often done at the beginning of a shift. It's a very common task, right? We're not saying that it's not a task you would do, but it's asking which one needs to be done first. Now, organizing supplies, yeah, it's done, but it really shouldn't take priority over other matters. So let's get to the others. Toileting a resident on a toileting schedule. Now, if they're on a toileting schedule, that means that every 2 hours we're taking them to a toilet or at well-defined intervals, before meals, before bed, that type of thing. So toileting schedule means we're maintaining a toileting schedule, but you've got about 15 minutes on either side of that time to play with. Assisting a patient to an activity, well, that activity might be starting at a specific time, right? And that's important to get the patient there. So that's going to take a little bit of a priority, but nothing bad is going to happen to a patient that doesn't arrive to an activity on time. But let's look at that call light. Okay, so all of these could possibly, there's a case that maybe that could be the right answer, right? So A, B, C, 1, 2, 3, those all could be the right answers, but let's look at why number 4 is the right answer. Every time a call light goes off, we have to consider that a potential emergency. And CNAs lose sight of this a lot because 99.9% of the time when a call light goes off, it's, I want a cup of water, I dropped my remote, I need a blanket, I need to go to the bathroom, right? All these mundane things that we don't consider priorities, right? We consider them nuisance calls. And a lot of people who are just kind of lonely will hit the call light and ask for something kind of meaningless just to get some attention. And that's very, very common. So we look at call lights more as nuisances. But remember, if somebody is having an emergency, they are told to use the call light. So we don't know, is that call light somebody that's having chest pain? Is that call light somebody that just fell out of bed? Is that call light somebody who's projectile vomiting blood because they have esophageal varices? Is that call light the neighbor, the roommate of somebody who's currently having a stroke? we don't know that that call light is a routine, boring, mundane task until we answer it. And a lot of times, emergencies are missed by CNAs and care is delayed because they stop paying attention to those call lights. So call lights are always going to be priority. And you're going to see a question like this on the state exam because this is a really big deal out there in clinical life. And CNAs are forgetting the purpose of the call light. So you're going to see a question like this on the state exam that gets you to understand or shows that you understand the importance of those call lights. So I hope that helped you guys. Yeah, call lights can be way more important. They're a priority because they could be an emergency. Ava says, I've been watching your live shows like crazy because I take my knowledge exam tomorrow. Oh, congratulations. Oh, it's super exciting. Let me know how you do, but great vibes out to you. You're going to do fantastic. Fantastic. And you did your skills exam on Thursday. Awesome. Awesome. Yeah, Blue, absolutely. Call light could be asking for ice water because they're guzzling water. And if it's not usual for the patient, what do we have to do? We got to report that. Yeah. Oh, thank you, Toby. So, or Mahala, thank you. Thank you. Okay, so let me turn this back on. Let's see how we did. Let's look at our scores for this. I know, Blue, I'm working on it. I know. it's a high level item for me. We just taped all of the skills videos. I'm super excited to get in there and start editing those. Some of my time is going to be freed up in the next I would say I've got about another week of frantic, and then my time is going to be freed up to take on some of these other fun projects. So I can't wait. Can't wait. Spend more time with you guys. All right. So for that question, remember this is that question. Jay came in first, Andina, Cass, and Jen. So that was that question. Let's look now at how we did overall. First place went to Ava. You get a t-shirt. Second place went to Rissa. You get a card game. And Hamdi, you're going to get some motivational items. So great job, guys. Great job. So let me send these out to you. So, oops, hold on. What happened here? Oh, I got to delete here. All right, so okay. All right. So you're going to send your emails out. My text message was too long there. You're going to send your emails out to 4YourCNA.com. So first place, you're going to send me which t-shirt you wanted. So CNA Care Core, you can have this one, which is called To Care in the Heart. Or you can have the Become Inspire Care. It's a white t-shirt with the Become Inspire Care with the CNA. So let me know the t-shirt choice that you have, your t-shirt size, and we also need your real name, your screen name, and your address. Second place, card game. We need your real name, your screen name, your address. Third place, motivational. Real name, screen name, address. Just send it all to number 4YourCNA@gmail.com. We'll get your prizes out to you right away as quickly as we can. And we really appreciate you guys hanging out with us today and getting to do a whole nother CNA game show. We will do this again in 2 weeks. So 2 weeks. We'll have another game show. I have class 2 coming up tomorrow, so make sure that you tune in for that. And Friday is my birthday. So I get to take this weekend off and go do something fun. So super excited. And Heidi, a pup date. The little one is still little and the sweetest thing in the world. Unfortunately, they're not in here right now, but her puppy, the newest puppy, is getting huge. So next game show, I'll make sure I bring the pups in so that we can give you guys a pup date on that. So super excited to hang out with you guys today. I really, really, really appreciate it. And I hope you have a fantastic week. and an even greater weekend. And I will see you guys on the next game show in 2 weeks. Until then, happy caregiving. Bye.